Torn earlobes are kind of interesting in that they occur sometimes because the ear ring is pulled through the ear, and sometimes it's not completely pulled through. It's just they've worn an earring for so many years that the hole gets stretched. Either way, the defect has skin on both sides, and so in order to make the skin stick back together, you actually have to take out a little bit of skin on either side and then sew the front and the back together. This is done under local anesthesia, should be very straightforward. And we let the ear heal for 4 to 6 weeks before we bring the patients back, and then we repierce them for the patient, usually in a little different area, not in exactly the same area, the same hole, because that area is weakened. You have to be careful with ears that are pierced because sometimes, particularly in multiple piercings, you can end up leaving scars called keloids and up the ear, and also you can get an infection. So you have to be careful with piercing the ears. It's very popular to do a lot of piercing today, but you can get an infection with that, and can lead to having even the scar tissue needing to be removed. But piercing should be very safe, and it's a straightforward procedure.